Tonight, President Trump is back in the White House. He left Walter Reed Medical Center later this afternoon after being treated for coronavirus. But the virus does keep spreading through the president's inner circle. Press Secretary Kayleigh McEnany is the latest to test positive. Now, many are asking the question, who was the first to get it and when did it spread? Well, we've been asking those same questions here in Colorado. When it comes to mass outbreaks at gatherings, mass gatherings like those in Boulder recently involving college students. Alan Janae looking into that tonight. Alan, many believe what is happening in D.C. is tied to what's known as a super spreader event.
Well, let's talk a little bit about that, Jim. When you pass through a place like Union Station, even at its busiest, you are not likely to be involved in any super spreading event. The CDC said again today the main way this virus is transmitted is through droplets. Droplets that are expelled when we cough or we sneeze or we breathe or we talk, especially loudly. But defining a super spreader event is more difficult. In a quiet evening commute in Denver, it's just not going to happen. It takes a concentrated gathering, says CU researcher Professor Jose Jimenez. He thinks the Rose Garden ceremony was less crucial than what happened before it.
My best guess is that the transmission happened mostly indoors.
He studied a super spreader event at a choir concert in Washington state early in the pandemic, in which one person shared COVID-19 with 52 people. It takes singing or shouting or hard breathing. In Colorado, the governor has referred to gatherings in Boulder when talking about super spreader events. Proving mass spreading is not easy, says the head of Jefferson County's pandemic response.
Are people honest with you when you contact Trace about where they've been necessarily?
We do the best. We build relationships with the limited time that we have available. We're just hopeful that, they pick up the phone and they answer the call and they give us the information that helps us control the disease in the community.
It's not yet been shown, says Jimenez, that there are super spreading people.
It's a window of about 3 days is what people think. The 2 days before the symptoms start and the day in which the symptoms start or the day after that.
But taking chances is where problems start.
You may do the same thing many times and not get infected, and then you do it one more time, and then you have the bad luck that someone very infectious is there, and then a lot of people get the disease.
Certainly in Colorado, we have had a lot of people get ill at workplaces and nursing homes, but those are outbreaks per definition because the infections have occurred over a longer period of time. Billings says in Jeffco they've had outbreaks at things like weddings and family gatherings, but they consider them that because the numbers are low. Jimenez says that what happens when we have a mass event is that a lot of people, in effect, are playing Russian roulette. In Denver, I'm Alan Janae, covering Colorado First.
Alan, thank you.